Hi guys, welcome back to my channel. This is your girl Pearly. It's been a while since I filmed a video, but today I'm coming with you with an emergency room nursing video. Information, tips, how you get in, how to do care pretty much. So let's get into the video. So today we're going to talk about how do you get into the emergency room. One way of getting into the ER is finding a program. What do you call those programs again? I can't remember. New student nursing program that the hospital will sponsor. So they will train you into the program. I think it's a very stiff application process, and the selection the hospitals are choosing from quite a bit of students to start in their program. So that's one way where you could choose the department in which you want to start. Another way is finding a hospital that will actually train you if you work on the floor in that particular hospital. Some hospitals are willing to train you to become an emergency room nurse. Usually the training is 6 months if you're new to the ER, depending on the hospital, of course. And for new grad nurses, that's usually a year's program. Okay, so what makes a great emergency room nurse? Number one, time management. You have to know to manage your time well. This is critical, or you'll always be behind. You'll always feel frustrated. You'll always feel like you're chasing your tail. And it's also a matter of safety. You have to know what patient needs to see you first. Everyone is sick. Everyone thinks they have an emergency, but in fact, you know the patients that need to, if you don't see that patient first, you're risking limb or life. That's how you decide what patient to see first. Communication skill is another big thing. You have to be able to communicate with your patients. You deal with quite a bit of irate patients, and you deal with long wait times. So communicating with your patients, what's going on? How long is this lab work going to take? How long before the doctor can come in? Never give a time on when the doctor could see the patient, but you always want to just keep the patient updated, informed, communicate with the doctor and the patient. Just let everyone know what's going on. How long does a CAT scan take to come back? Depending on the problem, are they waiting for a specialist to come and see them? Just so that you have a patient that understands, it's not quick service. Another thing is anticipatory care, which I want to talk about quite a bit as far as anticipatory care. Anticipatory care, I'll be looking down because I made some notes, has to do with if a patient comes in for a particular complaint. Excuse my child in the back. Okay, guys, welcome back. I had to do a quick location change because my son decided to wake up. So, where was I? I was at anticipatory care. So, anticipatory care is pretty much seeing the patient's complaint that you'll be getting and setting up and getting ready for that care. For example, if you have someone coming in for chest pain, you automatically know that you're going to put that patient in a gown as soon as he hits the room. You're going to need an EKG. So some hospitals will allow you to put the EKG order in. So you could do the EKG and then you show the doctor the EKG right away, just so you could rule out a STEMI, or what the regular person knows as a heart attack. STEMI is just a way more dangerous form of heart attack. You want to place the patient on a monitor. You need a line for your IV and your lab works, because you're always going to need lab works. I would draw what we call a rainbow, which is the whole array of things on the patient, or standard labs on the patient. So by the time the doctor comes to see the patient, you already have a line. Patient is already on the monitor. You already have labs. So which doctor is going to order all those things? So the only thing your patient will need is if any x-rays or any extra lab works or so forth is ordered. Okay, I'll keep my patient on the cardiac monitor, blood pressure at least every 15 minutes, monitor pain, and oxygen as needed and if ordered by the physician. Another thing is respiratory complaints. right? If you have someone coming in with a respiratory complaint, could be anything, shortness of breath, any of that stuff. Patient needs to be in a gown, in a comfortable position, preferably with the head of the bed elevated so that they could expand the diaphragm, expand their lungs in breathing. O2 saturation is needed. BP at least every 30 minutes, and you always want to put the blood pressure cuff on the opposite arm of the pulse ox so that you don't get, once the blood pressure cuff inflates, it doesn't affect the reading of your oxygen saturation. Okay. Consider, of course, with all respiratory complaints in these days, infection control. So whether airborne, droplet, mostly droplets, so make sure you're protected as a nurse. All right, so you, for that particular person, you also need an IV, lab lines, because that's respiratory, and you really don't want to play with that. You want saturation on room air so that you know how bad the patient is, versus when you put them on oxygen. Did oxygen help, or are they still low on oxygen? If they're still low on oxygen, then you know there's really a problem. And sometimes you could tell too, if they have a fever and sats are low, they have a nasty cough, sometimes you know, okay, probably that's pneumonia, versus is that asthma, where you'll hear wheezing, so forth. So you put all of that with your assessment, and before the doctor even comes in, you're pretty much aware what's going on. Trauma alert, we could go over that, but not a lot of people work in a trauma environment, and everyone does trauma differently. If you have a stroke alert, a lot of ER, stroke alert is everywhere at this point. Make sure that your bed is zeroed. If you're working in a stroke room, I'm not sure if you guys have stroke rooms set up differently, but if you're working in a stroke room, you always want to make sure that your gurney is zeroed, the scale that is on the gurney is zeroed, because one of the most important thing for a stroke patient is you're going to need an accurate weight, right? You always want to have a glucometer present, because another thing is weight, blood sugar, 2 IVs. Make sure that is there, and someone for charting. You need your portable cardiac monitor, blood pressure at least every 15 minutes, O2 sat, and prepare to transfer that patient to the CT machine. So you want to have everything ready to go. Once the doctor say go, let's go to CT, you're able to do that. You always want to bring an IV pump to CT and tubing, just in case you have to give TPA. If it's if you guys do TPA in your ER, you want to make sure that you have everything to do, because we are able to give TPA in our CT room once we realize that it's not a stroke, a hemorrhagic stroke, which means bleeding in the brain. It's a clot. Okay, that's that. Another example, if you're receiving a code 3 ambulance, that's an ambulance coming with an emergency. You don't really know what's coming. You get the vital signs, you get the ring down, and based on that, that could tell you what you need in your room, okay? Make sure you have disposable leads, disposable blood pressure cuffs. Your O2 is ready. Your weight gurney is ready. Ultrasound at bedside maybe. You have a stool in case you need to do compressions. Upon arrival, if you need compression started, make sure you have enough staff as well. Make sure the doctor's in the room if he's able to. You want to set your blood pressure at least every 5 minutes if this is a really unstable patient. And you just want to be as prepared as you can. That's the main thing. And with any procedure, for example, a lumbar puncture, if you're doing that, make sure that you have everything at the bedside. Proper PPE, because that's somewhat of a sterile procedure. Your LP tray. You want to make sure your patient is in the correct position for the doctor. Ensure you have enough staff, because one staff might need to help position and stay with the patient if they're a little bit nervous while you help the doctor and so forth. Abdominal pain in female, always, always, always. Sometimes if you're in triage or you're walking back to the room, always make sure that you have the patient pee, urinate, because that's the first thing you need. You need a pregnancy test and a urine for abdominal, any kind of abdominal or pelvic pain. You're going to need labs, so you need an IV. because abdominal covers a whole array of stuff. Like it could be anything. So that's the easiest. And you always, if it's pelvic pain, always set up for a pelvic exam. Just go ahead and do it because you're going to need to do it anyways. So just saving time. Anticipatory care helps you to time manage and have everything ready way ahead of time. If you have a laceration, make sure that you have, some people have their laceration carts, but if you don't, just get all your sutures, everything, all your irrigation, dressing change equipment, all of that stuff, get them ready as needed. Okay, if you have an abscess, similar thing, patient needs to be gowned, chucks under the affected area, and all your stuff, your IND tray, suction in case it's a deep abscess, cotton swabs, 4x4s, your blade, your scalpel, everything that the doctor will need. So, and also another big one is a eye complaint, especially if you're working as a triage nurse. Just do the visual acuity before the patient gets to the room. That is so helpful. And to have the patient in the room, and then you're like, okay, let's head back out to do the visual acuity, because not every room, visual, what do you call that? Snell chart, whatever it's called, is not set up with a chart. So sometimes that chart is in triage, or if you have if you have an eye room separate, then that's great. You could do a visual acuity there. All the other stuff, hopefully you could get there. Another big complaint is sore throat. Sore throat, sore throat, sore throat. So for that, you want to ensure that you have your throat swab, tongue depressor, ophthalmoscope. That's great to check in the back of the throat. So just have those ready. If you have that complaint before the doctor even goes in, nobody has to ask for those stuff, okay? For any kind of musculoskeletal injuries, you want to make sure the affected area is exposed so that the patient can be examined. As the triage nurse, you don't want to, or even if the nurse isn't there, just have the patient change. Have someone help the patient change. How are you going to assess the patient if they're fully clothed? You don't know what's happening under their clothing. You want to have ice packs ready as needed. Prepare the patient for x-ray and crutches, because more than likely possibility you'll be discharging with crutches. So that's a little bit to do with anticipatory care. Which this comes with experience, because as a new nurse, you won't know the stuff that you need. But as you get experience, focus on these things. Focus on the things that you need. Focus on what patient to see first, and focus on, once you meet that patient and you're doing your assessment, do a quick chart review so you could see what's going on, what's the complaint, what might I need to bring in the room, what might I need to do, and that will make your life so much easier. So much easier. Another big one is, especially if you have, again, lots of hospitals are different, but if you have a newborn, someone who's less than 1 month that comes in with a fever, never take a auxiliary or those little forehead reader thermometer via temperature. It's always a rectal temperature in those kids, because it's so easy for those kids to be septic, and you need an accurate core temperature for that. And know, as the nurse as well, if you have a newborn who's less than a month old with a fever, that's going to be a full workup. So just prepare for that. More than likely, you're going to need urine, which is going to be cath. You're going to need lab work, trying to get an IV in those little babies. I hate it. You're going to need possibly a lumbar puncture. You're going to need everything, nasal swab, who knows, everything. They swab everything. So just be prepared and manage your time. Seek help. Always ask for help. Emergency room nursing, you cannot do that by yourself. It's a teamwork. If you need help as new nurses, ask for it. Always ask. If you have any questions, ask, because it's so easy to make mistakes. I had a nurse once asked me, she's a fairly new nurse, 6 months in or so, and she couldn't figure out how to set up the oxygen, the suction canister thing. And there's no shame in the game. Just ask. A lot of nurses will be able to help you. So that's kind of how the ER works. Most ER census, you have 4 patients per 1 nurse. And if it's a critical patient, you could go down to a 1-to-1 ratio or a 2-to-1 ratio, depending. So in essence, once you get the layout of the land, you get to know your crew that you're working with, and you have a supportive staff. ER nursing is really fun, really a lot of fun. But again, it's not for everyone. It's not for that person who wants to take their time with every patient and everything is done to the perfect T. This is combining speed, which is great time management, critical thinking, anticipatory care, all of that stuff, combining all of that stuff so that you could practice safe nursing care. That's, I mean, how I can put it. And once you got that down, you're good to go. If you guys have any other questions, please feel free to drop me a comment down below. I think I do a great job at replying to people. I'll keep these videos coming if you guys like them. And if you have interest in going to nursing school, you're not sure what kind of nursing you want to pursue, it's such a huge field. You could do patient care, you can do the floor nursing. If you're into cardiac, you could work on a cardiac floor. If you're into surgical, you could work on a surgical floor. There is emergency room, the ICU, you have outpatient, doctor's office, recovery room, operating room, peds, PICU. If you like mother baby, you could do that. There's just so many things. You could do case management, managerial, if you want to manage people. Not my cup of tea. So there are so much things you could do. So if you guys have any questions and if you want to see more videos like this, just tell me what you want to see just tell me what you want to see below, and I'll try my best to do that. Peace. Enjoy your day. Have a wonderful evening. I have to go to work now. Bye.